Hey, Dave Butler here. I am in my clinic in our evaluation room where we see patients usually for the first time. And I wanted to share an experience that I had recently. I was working with a new patient, and I was talking to her about what was going on. And she's a long distance runner, and she was having some knee pain. And so we were going to talk about how we would help her with the knee pain. And as I'm evaluating, usually we'll go through a a history of what they have going on, and then we'll do a physical examination. And as I'm sitting here in this room, doing a couple of tests on her, she goes and stands on one leg, and I ask her how that felt, and she said it was fine. And then she said, "But can I ask you something about?" Well, no, she actually just said, "But my ankle," and then she stopped and she said, "At my old physical therapist, I could only ask about one thing at a time." So she hesitated to tell me about her ankle because we were seeing her for her knee. And this isn't the first time I've heard this. And it's actually really frustrating as a therapist, the way that we treat here at Align Therapy, to hear about that, because some clinics will tell patients that they can't ask about other things. If I'm seeing you for your knee and you need to be seen for your ankle, that you should make another appointment and do another evaluation on that. And they claimed that this is because of insurance restrictions, but really insurance doesn't restrict that. We can treat for multiple things with insurances. So there's really only one reason to tell people that there's two reasons. One is if it's under a different insurance, then they don't want to pay for something else. But really, it's just that they wanted her to come back for more visits and make more money off of her. So, but it was interesting as we started to look at her ankle, which she had brought up the information about. I started to realize that the ankle sprain she was talking about probably led to the knee problem that we were treating her for. And if she hadn't brought that up, then we wouldn't have had as successful of a treatment. We wouldn't have been able to see where it had come from and where the problem actually originated. So the reason I bring this up, the reason I'm doing this video about this, is I want to make sure that when you are looking for physical therapy, or you're looking for a specialized treatment in spine or spinal deformities or whatever it is, really any type of medical problem, make sure that who you're going to see is concerned about what's going on with you, and not just getting tunnel vision and treating something and getting out the door and getting to the next patient, but that they're really specifically looking at what you have going on. If you want to bring up other things, they should be more than happy to talk about other things that are going on. I think some physicians, it's hard because of time constraints. If you're going to bring up a whole other issue, it could be a little bit hard time constraint wise for them to do that. But physical therapy, we have time to spend with patients. We can talk to patients. We should have time to spend with patients. But like I talked about in a recent rant, insurance restrictions and insurances paying so low makes it so that physical therapy, it becomes kind of like your doctor's office, where you only see the therapist for 5 minutes. So really making sure that the value of your treatment is there, that you are able to ask questions, that you're able to get to the root of the problem, and that you're not stuck with the surface level or the superficial level of the problem. And that comes by having time with our patients, being able to discuss things, and not worrying about, oh, can I bring this up, or do I have to make another appointment? It's very common that I see things that people talk about that are affecting their current problem, that if we didn't talk about them, we couldn't get as good of a result, like the patient I'm talking about. So just looking at the value of your care, looking at some of those restrictions that are arbitrarily put on patients that shouldn't be. So hopefully who you're seeing for physical therapy, or if you're seeing someone for physical therapy, hopefully they're doing a good job for you and they're helping you out. If you're running into some of those roadblocks that you don't feel like things are going in the right direction, or you're getting to the bottom of the problem, it may be a time to get a second opinion. And if you live in Utah, Lehigh area, or anywhere close, we would love to see you. We love to see complex problems that have multiple things going on. So just make sure you're getting good value, getting good care, and not letting some of those restrictions stop you from getting that. So don't forget to subscribe to the channel. We try to put helpful information out there on a regular basis, and we look forward to seeing you soon. Thanks.